So good evening, everyone. And just for your awareness, the meeting is being recorded. Your cameras will remain switched off and your mics will remain muted. The only cameras that will remain on will be the panelists. If there is a major security breach, we will close the meeting and ask you to wait 5 minutes and simply rejoin using the same link. So a very warm welcome to everyone joining us this evening for our webinar, Coronavirus Vaccine, Safety and Effectiveness in People with Diabetes. My name is Alison Grant. I am one of the engagement managers in Scotland. The rollout of the vaccines is gathering pace across the UK, and I'm very grateful to our panel members for their swift response in agreeing to participate in this online event. We invited you to submit questions about the safety and effectiveness of the vaccine in advance, and where appropriate, we have grouped these questions together and we'll put them to the panel. There is also a question and answer function where you can type in questions for the panel this evening. You might want to take a minute just to locate that function on your screen just now. So if you're on a laptop, for instance, it'll be at the bottom of your screen. I'll just give you a minute to have a look at that. Okay, so hopefully you've all found that function. So we'll do our best to answer as many of your questions as possible, but we'll not be able to get into very specific individual circumstances. The format for the evening will begin with a short poll, and we'd encourage you all to answer the poll questions. It's very straightforward and it helps us to improve our services to you. I'll then invite the panel to give a brief introduction of themselves, followed by Professor Evans giving us a short presentation, and then we'll go into the question and answer session, beginning with the pre-submitted questions and answering your questions on the evening as well. There will be another short poll towards the end of the evening. So I'm now going to ask my colleague Mari to launch the first poll, please. Right, I think we've had a couple of minutes there, Mari. We'll take that down now. Thank you. Okay, wonderful. Thank you all for doing that. As I said, it really helps us to plan for the future and to improve our services to you. I'd like to now ask the panel members to introduce themselves. So if I can start with Professor Evans, if you just want to give a brief introduction. Thank you.
Hi, my name is Professor Tom Evans. I work in Glasgow, which is where I am at the moment, at home. I work mainly within the university as a specialist in infectious diseases and immunology. And I also work as a clinician. I'm a consultant in infectious diseases. And I've seen many hundreds of patients with COVID-19 over the last year.
Thank you. Kashif, would you like to introduce yourself?
Good evening. Good evening, everyone. My name is Kashif Ali. I am a GP, also from Glasgow. I work mostly in primary care as a GP. I'm also a GP trainer, and I have a special interest in diabetes. Within Glasgow and Clyde, I am the primary care lead for the Diabetes Managed Clinical Network. So over the past year, we've seen significant changes in the way we work, and we've been on the front line dealing with patients with COVID-19. And at the same time, I've been trying to do my best to help patients across Glasgow and Clyde in managing their diabetes as well. So it's been a challenge on many fronts.
Thank you, Kashif. Dan, would you like to say a few words?
Yeah, good evening. Thanks, Alison. My name is Dan. I'm the head of care at Diabetes UK. So my team and my responsibility is to make sure that the things that we talk about from a diabetes perspective is clinically accurate. I'm a diabetes nurse consultant by background, and during the pandemic, we're here to help support teams across the UK in each of the 4 nations and people with diabetes, healthcare professionals, just understand a little bit more about what we're trying to deal with. So we're not so much on the front line as Kashif is and Tom, but more on the line behind, I'd like to think.
Thank you very much, Dan. Thank you. Tom, can I just ask you to now go into your presentation? Thank you.
Great, thanks very much, Alison, and thank you very much for, and to your colleagues for asking me to come along today. I'm not a diabetes specialist, but obviously as I work in general medicine as well, I see a lot of patients with diabetes. My father for many years had maturity onset diabetes, so I've seen it both from the professional side and also from the patient side. And I think we all appreciate some of the anxieties and questions in many different areas of COVID, and we're obviously focusing tonight about vaccination and the particular questions around that. I would encourage you to ask questions. We've obviously got a lot of questions that were sent in beforehand, but I would encourage you to use the question and answer session, and you know, don't be timid. If you never think, I'm a great believer, there's no such thing as a stupid question. Ask away and we'll do our best. I'm sure we won't have all the answers, but we'll do our very best. And just important, we can't get into individual things, obviously, but try and make them a bit more general that apply to everyone. And then secondly, I do have some input into science information that is then taken up by policy leads across Scotland, but I don't make up policy. So if there's specific issues to do with policies about how a vaccine might be rolled out and so forth, we'll give you some help in trying to understand how that might apply, but it's not us who make those decisions, but we can help back up with the science that I think goes towards helping it. So I've just put together some slides that just address a couple of the issues that came up, and I promise you these will be very quick. I don't want to spend too long on this at all. I'll just make that bigger. Yeah, so first question, if I have diabetes, am I more at risk from COVID-19? And I'm sure most of you know the answer to this already. Age is the most significant risk factor, and tragically, as you get older, the risk of you having an adverse outcome, needing hospitalization and sadly dying from this disease becomes higher and higher the older that you get, which isn't to say that you might not be affected if you're younger, but certainly younger people are going to do much better than if you're older. And that's very true once you get into the 60s, 70s and 80s decade. And that just remains the most significant risk factor. But we do recognize too that a number of medical conditions also increase the risk of hospitalization and of dying. And probably across the board, diabetes increases the risk by about 2 to 4-fold of death, and possibly slightly more for type 1 than type 2 diabetes. But do remember, age is still important. If you have diabetes but are young, still your risk of death, sure, it's more than someone of your age who doesn't have diabetes, but it's still relatively small. And I think that's just important to bear in mind. So just a quick run through to some of the issues. So when will I get vaccinated? Well, we know the expert group who advised government on vaccination schedules have drawn up so-called priority groups, and we're working very hard to ensure that those in the first couple of priority groups already, many of these have received vaccination, and that this will gradually come down. And different governments are trying very hard to get this through as quickly as possible. Diabetes, both type 1 and type 2, generally will reside in the at-risk group, so priority group 6, although there may be some people who will be classed as clinically extremely vulnerable individuals who would then fall into class 4. And that will include some people who have diabetes as well. And the aim in Scotland certainly is that groups 1 to 4 will be vaccinated by the beginning of March, and all the groups by the start of May before going to the rest of the population. But that's clearly dependent on vaccine supplies and so forth, which is certainly can be tricky. Now, are all the vaccines the same? And this was a question raised by a number of people. So currently there are 2 vaccines licensed for use in the UK. One made by Pfizer with the participation of a smaller company, BioNTech, who developed it. And this was the first one to be licensed. And then a second vaccine has just been licensed, made by AstraZeneca, also known as the Oxford vaccine, developed with a group at Oxford University. And I should stress, both of these work very well in large trials in preventing symptomatic disease of COVID-19. And amazing to think that we didn't really know this disease didn't exist until the end of 2019. We've now got a vaccine for it that works, and it works very well. And that's incredible that that's happened over such a short space of time. Now, the Pfizer vaccine had an overall 95% protective effect, which is obviously very, very high. And the AstraZeneca vaccine was slightly lower at 70%, but still very good. There was a slight difference in one subgroup who had a lower initial dose, and that may be something that well, certainly being looked at in a further trial, but we won't know the exact answer to that for some time. Now, both gave an excellent protection after one dose, but in the trials, a second reinforcing dose was given. And I know there's some questions coming up about that, so I may go into that in more detail in a little time to come. But the duration of the protective effect is not yet known. It's not known how long this will last for. So some people ask, I've heard there can be serious allergic reactions after vaccination. Is this a significant risk? So really, to set your minds at ease, serious allergic reactions are very rare indeed. In fact, there've really only been a couple, or at least a handful of these in the United Kingdom so far, and that's true internationally as well. Importantly, you can get the vaccine even if you have a known food allergy, like a nut allergy, or if you're allergic to a drug, say you're allergic to penicillin, or you have an allergic reaction to bee stings or other insect stings. You still can get the vaccine. Very, very rarely there are people who are allergic to one of the components of the Pfizer vaccine. I should say there's a third one that will be available in the UK at some point, made by Moderna. And this is what we call a preservative in the vaccine that keeps its ability to survive at room temperature and so forth. And this might be the case if you have multiple serious reactions to multiple classes of drugs, or you've had a serious allergic reaction to a previous vaccination. But these are very rare. And if in any doubt, please do ask your doctor and they will give you further information on that. So what might you expect after vaccination? And again, in general, the common side effects were very, very mild. Typically the sort of things you get after the flu jab. So a lot of people got pain in their arm after having been injected, and that was very common. Certainly feeling a bit whacked out, a bit tired, a bit of a headache, aching muscles, joints. Quite a few people got fevers, and it's important to say that that is mild and it usually resolves within 48 hours. So we wouldn't then expect you to be phoning NHS Inform or NHS helplines to say, have I got COVID? That would entirely be expected. But obviously, if your symptoms worsen or persist more than 48 hours, then certainly you should get in touch. And as I said, it really has exactly the sort of adverse, minor adverse effects that you'd expect from the flu vaccination. Some people are obviously on medication to thin your blood, warfarin or antiplatelet agents, things that keep your blood thin and stop it clotting. And in general, this is very safe with these drugs. And I put in a long text there, which I'm not going to go through now, but you can see on the recordings and when the slides are available. There's really no risk, adverse risk if you are on these agents and everything's going well, i.e. your regular testing shows that you're not your blood's not over thin. They will use a slightly smaller needle, but and just applying firm pressure, very common sense things. And you may get a bit more of a bruise, but honestly, I think this isn't a big deal. I've had the jab myself, and I can tell you the volume injected is tiny and you barely notice it. So I think this isn't going to be a big problem. And that's all I wanted to say. I think there are lots of other questions that will come up and we'll try and answer them, as I said, between the various people here. So thanks, Alison, back to you.
Thank you, Tom. That was really, really interesting. And as you say, I think you're already starting to address some of the questions that have been coming in. So we'll now go on to the pre-submitted questions. And just to let you hear a change of voice, my colleague Mari and I will alternate asking these. So Mari, would you like to ask the first question?
Yes, that's great, thank you. So the first question is, should you take your diabetes medication on the day that you receive your vaccine?
I think Kashif and Dan can certainly answer that, I'm sure.
Yes, I'm happy to take this one. Yes, absolutely. You should take all your prescribed medications as you would any other day. And as Tom had mentioned, it's similar to getting your flu vaccination. So you wouldn't do anything differently. So absolutely take your medications that you take for diabetes, whether these are tablets or your insulin dose, at the same time, at the same dose. You don't need to do anything else.
Thank you. So the next question's kind of got two parts. So if you also take other medications such as heart, blood pressure, liver, asthma, kidney, is it still okay to get the vaccine?
Yes, absolutely. You know, I was actually vaccinating most of yesterday in our patients who are over 80 years old, and many of them were on multiple medications, and absolutely there's no reason why you couldn't have the vaccine if you're on multiple medications. And as I've already mentioned, you should take them as you're normally prescribed. I think in terms of whether you have any underlying kidney problems, again, regardless of that, it's still safe to have the vaccine. And if you're on any medications for that condition, again, you just take it as planned. You don't need to take any special precautions.
Thank you, Kashif. Somebody's got a slightly more specific question along that lines. Is it okay to have vitamin B12 injection at the same time as having the COVID-19 vaccine? This person is normally offered and receives the flu vaccine at her vitamin B12 appointment.
The answer is there isn't any reason why you couldn't have that, but being involved in these clinics, they're exceptionally busy. And we're trying to get through as many patients as possible. So what we encourage our patients to do is not to ask about their regular medications or their conditions and allow the vaccination to happen so that we can move on to the next patient. So, and also because we want to monitor how people are after a vaccination, we don't normally advise giving 2 vaccinations at the same time, whether that's an injection like your B12, I mean, that's a discussion you can have with your nurse or your doctor when you're attending for the injection. But normally during these current times, we're trying to limit how much time people are in the room, and we would encourage you just to try to stick to the reason why you're there, and you may need to make a separate appointment to discuss any other health problems.
Thank you, Kashif. Sorry, Tom?
Just to chip in and emphasize what Kashif was saying, clearly logistically, you know, trying to get the throughput in these centers is very challenging. But don't worry if you need another vaccination. Hopefully most people will have had their flu jab by now. But the advice is that, as Kashif said, because of we don't want to get confused with side effects from one dose or the other, the recommendation is to leave at least 7 days between the 2 different vaccinations. But that doesn't mean you can't get the flu jab and the COVID vaccination. It just means just a slight bit of planning there.
Thank you. Mary, do you want to ask the next question? You're on mute, Mary.
Beg your pardon. There have been various questions about the different types of vaccine that are available. Is one more efficient than the other for people with either type 1 or type 2? And can you tell us the difference between the 2 vaccines?
Yeah, I can address that, and that's a really good question. Currently, in the UK, we've got supplies of 2 vaccines. As I said, it's the Pfizer-BioNTech one and then the AstraZeneca one. And they are rather different. And I don't want to go into the nitty-gritty of the differences, but they both work. And I think that's the important thing to emphasize. In the one that most people are getting now is the Pfizer one, but increasingly the AstraZeneca one will be used a lot. There is a difference in how they can be safely stored and delivered to places that Kashif was saying where they're doing lots of immunization. It's much more difficult for the Pfizer one. It requires to be kept at very cold temperatures. It can't be shaken too much. So it's more challenging, whereas the AstraZeneca one is much easier to transport. It can be kept at sort of the normal kind of things we're used to with vaccines in the fridge. So it's much easier to give out. The head-to-head hasn't been done, but we know from the different trials, the Pfizer one was slightly more effective than the AstraZeneca one. But I don't think the difference is huge, if I'm honest. Sure, there was a slight difference, but I think both are good, and I think I'd emphasize that. They both have a very similar side effect profile, and they're both safe. And as I said, the monitoring showed very much that the serious effects from these are really very, very rare indeed. So I think both will be good. I think as time goes by, more people will be offered the AstraZeneca one. I think the supplies for that will be easier to get and easier to transport around the country, which I think is the key thing. I can't remember, Mary, were we going to talk about the intervals between the two vaccines, or was that going to be a separate question, or shall I address that now?
Well, you can if you'd like to take that up now, but there have been questions about that, so that's fine if you feel it's appropriate to use it now.
So just to finish off, and we know from the trial that trials are done in a very set way. You do, if you fulfill the criteria for entry, you get drug X, drug Y, whatever, and the same with vaccines. So for both of these vaccines, they were given as 2 doses. And that's quite common for many vaccinations. You give a dose and then you give a sort of like a booster to help the effect really take hold. And there's been some concern because, as you know, the policy has been to wait rather longer than was done in the trials to give the second dose. And the reason for this is actually based on some pretty good science, in as much as the data from the trials showed that protection after the first dose kicked in pretty good, actually. After about 9 or 10 days, you saw a really very, very good protective effect. And that gives us great confidence that you will have immediate protection. The question then is, well, how do I know that's going to last and really keep on protecting me until I get my second dose? And that's a bit of an educated guess, if you like. It's supposition, but we know from measuring levels in the blood of the response that the vaccine produces that it does. You know from previous studies that is likely to last for some months, because we know from when people are vaccinated against other things. So it's a reasonable, scientifically based evaluation that you will remain protected until you get your second dose at this rather longer time interval. So I think I would be reassured about that. And I well understand there's been some concern, and certainly concern amongst my colleagues and healthcare professionals. But I think you can understand what we're trying to do is to get as many people as possible vaccinated so that we can offer protection to the most vulnerable people as quickly as we can. And that you will get a second dose, it's just going to be slightly longer. And finally, that we don't really know how long, even after that, the protection is going to last. Is it a year? Is it 5 years? Is it for your life? And that will be followed up, and we'll just have to see how that pans out. So I've gone on far too long. Kashif or Dan, I don't know if you wanted to add anything to that.
No, that's a very comprehensive answer, and I think I mean I can certainly talk about my experience. I had the Pfizer vaccine myself, but we are using the Oxford vaccine in general practice in our own surgery just now to vaccinate patients, and we've certainly had no issues at all. We've vaccinated over 200 people in my practice, and the side effects have been very mild. And I can also talk about my own experience as well. I had a slightly sore arm, mild sort of headache, and everything was better within 24 hours. And one of the things that I was saying to my patients yesterday is that the older you are, there seems to be less side effects, which is good. Yeah. But no, I've got nothing else to add there.
Thank you, Tom and Kashif. Actually, Tom, you just mentioned, you know, the length of protection that's offered. Somebody actually put a question in the chat saying they'd read or heard somewhere that the protection is 5 years. Can you make any comment on that?
The honest answer is we don't know. We know from people who've had natural infection with COVID-19 that they certainly retain what we call their antibodies in the blood. These are the things that our bodies produce as part of our immune response that help fight infection. And those certainly persist for well over 6 months. But obviously we don't know, because this infection's only been around really in the UK since last March. So we'll just have to wait and see. I mean, we all hope it'll last for a long time. But as you know, with the flu, we have that annually, and you know, it works well. And actually, these vaccines are better than the flu jag for the as far as we can see at the moment. And I should just add, it was part of the last question, I forgot to say it. Is this equally effective for those with type 1 or type 2 diabetes? It wasn't specifically looked at in those groups, but when both the manufacturers who trialed these vaccines compared different risk groups, there didn't seem to be any issue with if you were older or if you had an underlying medical condition. So again, I'd be reassured, there's no reason to suppose you'd be any less protected than if you didn't have diabetes.
Thank you for those really comprehensive answers, and my apologies, I should have said 5 months, not 5 years, but I think you've explained it anyway. Next question, is it safe and effective to have a different vaccine product when receiving the second dose?
I can answer that quickly, and then I think I'd be interested Kashi's views on patient acceptability. The bottom line is that this would be exceptional. It is not something that's going to be the norm at all. It was only raised if there was a significant supply issue. And the feeling was it would be better to get at least a boost from something else rather than not have the boost at all. And I think that's the important point. I should say, from other research and other vaccines for slightly rarer diseases, that sort of approach where you give one vaccine and then boost with a different one is actually quite well established. So we don't know how effective it would be, but I think it would only really be exceptional. So Kashif,
you've gone on mute, Tom.
Yes, no, I agree. I think that's the information we've been given as well, that it's a very exceptional situation that would occur. But certainly, I think in the patients I've personally vaccinated, they were perhaps more relieved that it was the Oxford vaccine rather than the Pfizer one. And I think, I don't know whether that is because it's linked to Oxford University and it's perhaps a UK-based one, or they had heard there's less side effects. But as Thomas said, there's very little difference between the vaccines. Both are very effective. And I think the vast majority of patients I've met so far are just relieved they're getting any vaccine. I think it's been an absolutely monumental effort for everyone that's been involved in this process and this project. And many of my patients have had concerns that it's happened so quickly and things have been rushed. And I just said, well, look, science has really moved on in the last few years, and everyone has been focused on this vaccine. A lot of the pharmaceutical companies, a lot of energy's gone into this, a lot of funding's gone into it, and also a lot of the red tape around getting vaccines approved. A lot of that has been, it's been allowed it's been removed so that these processes can happen quickly. And also, I personally had volunteered to be one of the people to be tested for these vaccines, and I wasn't required, which just shows, there was such an impressive uptake of volunteers for these studies, and that usually is one of the stumbling points in trying to approve new drugs or vaccines is getting these tested in healthy people. So I think everything was aligned, and I think we've really witnessed a miracle for these two vaccines that we're using now to be approved within a year.
Thank you. Thank you. We'll move on to the next question, which I think we've partially touched on. So asking, has there been any evidence of side effects particular to type 1 diabetes patients with reference to their blood glucose levels and CGM results, and supplementary, has it been tested on people with type 1 using insulin pumps for control?
So a quick answer is those specific groups weren't particularly looked at. As I said, they're just a range of people with different medical conditions. There's no evidence that the vaccine alters your diabetic control. Obviously, if you get a mild fever, it may mean you're perhaps a little bit more likely to get a bit dry, a bit dehydrated, and it's important to keep your fluids up. If that's the case, make sure you take in plenty of oral fluids, but don't stop your diabetic medication. I think that's the key thing. Kashif, I don't know if you want to comment on the experience you've had with the vaccination so far.
Sorry, I think Dan wants to come in first, if that's okay.
Sorry.
All right, thank you. Yeah, I think it's really worth, as Tom has said, that there's nothing kind of studied, there's no evidence to say that it will or won't do anything to your diabetes. But as we know with people with diabetes, that when we go and have if we think back to any other kind of jabs that we get, whether they're travel vaccines or your flu jab, or any other kind of injection, they might cause your blood sugars to slightly rise, but not in a kind of significant way. If you were to get a side effect that was the painful arm because of the ache and an inflammation response, so your body's trying to think what's going on, it might throw out a little bit of sugar from your liver, which will put your blood sugars up. So it's really important to continue testing after you've had your jab. And as Tom said, to keep hydrated, keep monitoring your blood sugars if you already do that, and just see how you feel yourself. The other thing that might put your blood sugars up is the worry and the anxiety, which we know is an absolute, people living with diabetes, it is an absolute increment on your blood sugars. So trying to get yourself into a place where you feel slightly less anxious on the day that you're going for your jab, I think would be a really good idea. Of just trying to have some calm, just a little bit of you time, do something relaxing before you go maybe. And these aren't things that have been studied, but I think they come from a bit of an intellectual kind of guess for people with diabetes who are going for their COVID vaccine. That's the only thing I wanted to add in. Kashif?
Thank you, Dan.
Yeah, no, that's an excellent. I've not got much to add there, but absolutely. I mean, we've not vaccinated anyone specifically on an insulin pump, but I think, as Dan and Tom have mentioned, I think it's really important that you monitor your blood sugars and take your medicine as planned. I mean, any vaccination is a slight stress on the body, so you may see a slight rise in the blood sugars, but the important thing is to monitor it and not reduce or stop your insulin. And if there are any prolonged symptoms from or side effects, then you should contact your healthcare provider for further advice.
Thank you all. Next question, Mary.
Okay, the next one is slightly specific. It's has there been any evidence of side effects particular to type 2 diabetes patients? It's kind of linked to the last question, but
the answer is no, not specifically at all. And as Kashif said, it's likely that type 2, if you have type 2 diabetes, you're likely to be slightly older. And in fact, the side effects in that group was less, bizarrely, than those who were younger, which was interesting. So I think there's not much cause for concern. I don't know if Dan or Kashif want to add to that.
No, the same things go when we go for any vaccine or when we go for any procedure. It's important to if you've got type 2 diabetes and you do test your blood sugars, if you don't, just keep an eye out for your kind of own anxiety levels or any kind of symptoms that you get, and speak to your GP, practice nurse, or your healthcare professional if you're concerned afterwards.
thank you. Good.
Thanks, Dan. That's really good advice. Next question. How extensive was testing on people living with diabetes from ethnic minority communities, and were there any particular side effects recorded in these groups?
Yeah, I can address that to some extent. Not a huge amount of data, to be fair. We do know that those who come from minority ethnic backgrounds certainly have a much worse outcome from COVID-19 infection. And that's a really important aspect of this disease. I can reassure these studies that were done for both vaccines did include quite a large proportion of people with different ethnic backgrounds. So I think we can be confident the vaccine works irrespective of which particular ethnic background you're from. And the side effects, again, didn't seem to be particularly marked in one group or the other. So I think on those issues, I hope that can be reassuring. There's not, but to be fair, not a huge amount of data. So I don't know, Dan and Kashif, any other thoughts?
No, I also tried to look at some of the data, and yes, it has been studied in communities of Asian and Black and ethnic minorities, but again, there's no specific data about it, and certainly my experience personally and of vaccinating my own patients from a South Asian background, no, there's not been any increased side effects, and certainly even those with diabetes, type 2 diabetes, have not seen any increased side effects with the vaccine so far.
Thank you. You're on mute, Mary.
Sorry, the next question was similarly linked, but I'm going to just change it because it was speaking about ethnic minorities as well. But there was a specific aspect to it. It was asking, is it safe for someone with diabetes and asthma to have the vaccine?
Quick answer, yes.
Thank you. I think you've partially addressed this, Tom, in your presentation. The next question is, if someone has had violent reactions to medicines and anaesthetics in the past, how safe is it to have the vaccines? And if so, is one product safer than the other? This particular patient takes a wide variety of medication for diabetes and various conditions, including food intolerances.
Yes, so in general, it is safe for people who are allergic to have food allergies or allergic to penicillin, as I said. I think we know that serious reactions are very, very rare. There is a known reaction to one of the components in the Pfizer vaccine that's incredibly rare, but it might have come to light if you've had reactions to a vaccine before, or if you're truly allergic to many, many different drugs. We often find people say they're allergic to drugs in hospital, and when we actually ask them, oh, my mum told me, or something like that. So it's very difficult sometimes to know quite what a true allergy is. But certainly if you have very serious side effects to multiple drugs, I would discuss it with your doctor, absolutely. And I think that's important so that can be properly analysed and reassured or a plan made.
Thank you. Kashif, did you want to add anything to that?
No, I think that was a very comprehensive answer. I think the key thing here is that, as Tom had said, that there's a difference between true allergy and just intolerance. Many people have had reactions of some form. For example, they've felt sick, or they've had diarrhea or loose stools, or that doesn't always mean that you have had a severe allergy. Severe allergy may actually mean where you've had a significant rash, or you've needed to go into hospital or needed treatment for it. And as Tom said, it's very, very rare. And what we do know, certainly about the Oxford vaccine, there's certainly no animal products, and certainly those who may have an egg or lactose allergy, they don't need to worry. And peanuts, as I think Tom has already mentioned as well. And I should also say, in terms of ethnic minorities, that both vaccines have been deemed as halal for Muslim communities and kosher. So there isn't really any concerns from that perspective either.
Thank you, Kashif. Actually, can we just, I've just spotted another question which kind of relates to that allergy side of things. And it's about the skin reaction. So if there's a local skin reaction after the first dose, should the patient be monitored for longer after the second dose, particularly if there's a history of anaphylaxis?
So a quick answer to that, many people might have a little bit of redness on their arm after a jab for anything really, and that's not anything too much to worry about. If you get a very itchy rash, that's a slightly different kind of reaction. And the advice there is that if you get an itchy rash, and often you might get some bumps like hives on your skin. If you get something like that, the advice is certainly tell the person who vaccinated you. And when you come for the second dose, you're advised to be monitored for about half an hour afterwards rather than just the 15 minutes. And you would want then to be in somewhere which had immediate medical care, as most places which are offering vaccination are doing. If you're allergic to, have had a reaction to a vaccine before, a serious reaction, that's a slightly different thing just from a skin rash. And obviously you then should discuss that with your doctor to be sure that it's going to be safe for you, but that's going to be very rare.
Thank you. Next question, Mary. You're on mute, Mary.
You've kind of answered a couple of questions here together at the same time. So I'm going to move on now to a more specific one. If a patient has had COVID-19, do they still need to have the vaccine or are they immune?
Excellent question. We are offering everyone a vaccine, even if you've had it before, partly because we're not sure how long you remain protected after you've been infected naturally, and partly because it is going to be very difficult to know exactly who had it when, particularly as you know, back in March and April, most people didn't get a test who didn't get to hospital. So the answer is yes, and there is no suggestion that it's not safe to be vaccinated if you've had it before.
Okay, thank you.
Thank you. After receiving both doses of the vaccine, can a person still get COVID-19?
There is a small possibility that you could. No vaccine is 100% effective. So it is possible. What we all hope, but we don't know for sure, is that if you do get unlucky enough to get it after being vaccinated, we all hope that you're likely to get very mild disease. And there's some evidence to suggest that that's going to be the case, i.e. you have some protective effect, but it doesn't stop you necessarily getting maybe a little bit of a cough or a little bit of a fever. So that's the hope. We don't know exactly how that's going to play out, but that, you know, looking at other vaccines and so forth, that's pretty much what happens. So I don't know, Kashif, Dan, if you wanted to add anything to that.
No, that I think the important thing that I said to my own patients is not to stop using the current precautions that they have in place, the masks, the hand sanitizer, the washing hands, and the social distancing. And as Tom has said, that there is still a small chance you could still contract COVID-19, but with this vaccination, you are less likely to get severe disease. And remember, it does take time to build an immune response to the vaccine, so it's not immediate. It can take 2 weeks, sometimes longer. So the advice I've been giving to everyone is to still continue to follow government advice and restrictions.
Thank you for that, Kashif. Dan, did you want to come in?
Yeah, sorry,
well?
just if I'm listening to both of these great answers from Tom and Kashif, and as someone with diabetes in my head, my next question is, so if I've got diabetes and I still get a mild dose of, or a mild disease progression of COVID after I've had the vaccine, what will that do to me, diabetesly speaking? And, you know, we really don't know, but that we have to kind of reassure you that there is, for all the horrendously sad numbers of people with diabetes who don't do very well with this disease, there is an awful lot of people with diabetes who do okay and experience mild symptoms. They might have a rise in blood sugars, they might be unwell for a few days, but they don't require the kind of hospitalization that without the vaccine, currently, people with diabetes seem to do. So just rest assured that if you do get, when you do get the vaccine, and if you were to get COVID-19, your diabetes potentially doesn't necessarily mean that it's going to be all disastrous for you. Just wanted an element of reassurance, and I hope I articulated that right, just thinking on my feet.
No, that's great. And actually, Kashif, you kind of touched on a question that we've got as well about somebody had assumed that were immune when they got the vaccine and wouldn't have to practice social distancing, but you've made it very clear that everybody should still be following government guidelines. So thank you for that.
Another very specific question next. When will there be a vaccine available for children under the age of 16?
I think what we do know is that there is some studies. I think Tom may be able to talk about this more, but there is a study at the moment going ahead. So at the moment we just don't know if it's safe. So it's not to be used in children under 16. But I know Pfizer certainly, they are going to be publishing soon their findings, and I think until then we really can't make any comments on whether it's safe for children to have this. And we also know that by and large children are less likely to become severely ill with COVID-19, and as Tom had said right at the beginning, the older people are more likely to suffer from more harmful outcomes from this vaccine, from the COVID-19, not from the vaccine, sorry. So I think the way we're vaccinating people is the right way. We're vaccinating the people that are highest risk of dying and the highest risk of going into hospital. And thankfully, it's not affected children as badly so far.
Thank you, Kashif. Tom?
Yeah, no, just to absolutely echo what Kashif says, and those trials are ongoing, and certainly one would be very reassured that younger people and children particularly have either no symptoms from this infection or very, very mild disease. I know there are certain subgroups of children who've had adverse outcomes, and there are some very rare conditions that can be triggered by this infection, but they do remain very, very rare. So as a group, one could be very reassuring that they are safe and that we'll find out in due course whether the vaccine is something that they can have. Thank you.
Thank you. A question from a person who has she has diabetes 1 and several other autoimmune conditions, and is worried that the vaccine could trigger a new, different autoimmune condition.
So broadly, the safety profile of both the vaccines looks excellent, and that hasn't happened. Now, every vaccine, when it's used on a wide scale, will collect a lot more data from not just a few thousand people, but from hundreds of thousands and eventually millions of people. And only then will we know if they're very, very rare side effects, such as you've mentioned. But currently, there's no evidence that either vaccine produces that sort of effect. I think, to be realistic, every vaccine, if you look at the millions of people who get them around the world, there will be adverse effects that will affect a tiny, tiny proportion of people. And as with any medicine, we have to weigh up what the relative benefit is relative to the risk that it might cause in getting it. And for vaccinations in general, they're incredibly safe. They're some of the safest medicines that we have. And I would be very reassured that there's really no evidence currently that that's something that you're likely to suffer from at all.
Can I just add a bit of a supplementary point to that question? Do immunosuppressants make any difference to that?
That's a really good question. And the answer is both vaccines are quite safe if you're immunosuppressed. So if you're on drugs that make your immune system not work very well, or if you're someone who has HIV infection, for example, that's perfectly safe for you to have the vaccine. What we don't know is how effective it might be in the longer term. And that again we will have to wait and see. We know that certain drugs certainly lessen the body's ability to resist infection, and it may also make them perhaps less protected by the vaccine. So we don't know for sure, but we'll have to wait and see.
Thank you. Thank you.
The next question is probably slightly more of a political question than anything else, but it's if other occupations are added to the priority vaccine list, does this mean that people living with diabetes may have to wait even longer for the vaccine?
Yeah, it's a good question. I'm not a politician. I think the advice on the priority groups came from an independent body of expert scientists who devised that prioritization on the basis of who was most likely to have the worst outcome, or who could perhaps pass it on. So that's why we've gone for the over 80s and 90s, for those in care homes and the staff who work with them, and then for frontline healthcare workers who might inadvertently infect other people while they're in hospital. The scientific advice is, this is a new infection. We're always getting new information. So, it's possible it could change in the future, but I think given what we know about the virus so far, I think it's unlikely. So I don't know, Dan, Kashif, whether you think that's a reasonable supposition.
Yeah, no, I don't have much to add to that. I think that was a great answer.
Dan?
Yeah, nothing to add from me.
Thank you. And the next question is a slightly more policy-based one as well, and it's with regard to shielding. There are already calls for the economy to be unlocked after the clinically extremely vulnerable have been vaccinated. So it's following on from the previous question. If people living with diabetes are then moved further down that list, could this then mean they'd be expected to travel to work on busy public transport unvaccinated?
Yeah, it's another very good question. I think we don't know how life is going to look in 3 months or 6 months. We all hope that things will get back more to normal and that we can go out more, we can enjoy seeing friends and family, we can travel. But all these will have to probably be modified, because even though we vaccinate, as the question points out, we won't be reaching more and more people till really the autumn. So again, I don't make up policy, but I think it's unlikely that restrictions will be lifted so much that it would be you traveling on a crowded train or bus when you're not protected by the vaccine currently. So I think what we'll see, and again, this is, as I said, I don't make the rules, but I think any reduction in restrictions will be quite gradual. And I think, it'll be a phased response that will gradually see things get back to a more normal existence, but that it will be phased to make sure that the virus doesn't gain control and take off again. Because as we've seen, it's a mean thing. It can take off again. And, we were doing so well during the summer months, and it's come back really with a vengeance. Now the colder weather's got in and spread again. So I well appreciate the concerns people will have. And as I said, I don't make up the policy, but I think I think any reduction in the sort of restrictions we're living with will be quite gentle and phased in that way.
Dan,
so I don't know, Kashif, Dan, if you've got any thoughts.
Yeah, I was going to ask Dan if he had a Diabetes UK perspective there.
Yeah, certainly. There's a couple of, with that question, there's a couple of things to kind of get under. I think, firstly, I don't think that people with diabetes will be moved down the list. And if that was ever a talk, then you could guarantee that we would have something to say about that, alongside with all the evidence, really. And that's what people tried to base it on. If we look at the clinically extremely vulnerable, where they are in the list, and the clinically vulnerable, which is all people with diabetes or all adults with diabetes, then they aren't actually that far away from each other. There's two groups of people in between. I'm doing it in my head, so I hope everyone's seeing a table in my head. There's two groups of people, and these people, a lot of people with diabetes who will have already had their vaccine because they fall into the age category. So you'll get your vaccine if you're over 80, you'll have got it hopefully by now. And if you're over 80 with diabetes, you'll have got it by now. You don't have to wait till all the people with diabetes get it. So there will be a lot of people with diabetes that are covered. So I think that there won't be too much of a time delay, all being well. And again, like Tom, I don't make the rules, sadly, and couldn't tell you when your locality, because it's very much based on your local area, the process of how the vaccines are given out and you're contacted. So just an element of reassurance again. That's all I keep on saying, but hopefully it's helping. That people, you know, Diabetes UK is very comfortable with where people with diabetes are on the vaccination list. And yeah.
Thank you, Dan. Kash, if you don't mind, I'm going to move on. We're getting some great questions in, and I'd really like to address some of them. This is a really good question. If your diabetes is in remission due to weight loss and exercise, and you are off all medication, are you considered diabetic for the purposes of getting a vaccine, or will you no longer be in the priority group?
Yes, that's a very good question, and I'm hoping there will be more and more people in that same category. It all really depends on whether you are still coded as having diabetes in your records, or or whether you've now been, if that code has been removed, or if you now have a code of diabetes in remission. So it's something that you may want to discuss with your healthcare provider, your GP, or your practice nurse. It also depends how recent you've been in remission. So there's a few factors there. So the best thing is to speak to your GP or your practice nurse about that.
Thank you. Thank you. Lots of questions coming in. There's two about studies in Israel. So one said, can you address the recent news from Israel about the disappointing lack of efficacy after dose number 1? And another one said that they'd heard that in Israel, you seem to be a lesser chance of you passing the disease on if you've had the first vaccine.
Yes, so I've read those reports too. We don't have any, they're currently just media reports, so it's difficult to evaluate the actual evidence. Israel has vaccinated far more of its population than anyone else, which is amazing. They've seen very high levels of infection. I think at the moment, I would be cautious about over-interpretation. Because certainly we know that the virus spreads through close contact with lots of people in closed environments and so forth. And trying to dissect that out from whether you've had the vaccine or not is I think, challenging. So I think we will have to wait and see. There are cases of people who've had the infection twice, and that certainly has happened. In most cases, that's been relatively mild for the second time, but not always. And we don't know the true incidence of that, although it is relatively unusual. And sorry, Alison, the second question about Israel, sorry, I've forgotten, not just that it was more...
I think somebody had heard that there's some evidence that there's less of a risk of passing on.
Yeah, so we don't know. That's a really good question. What we all hope is the vaccine will stop it, even if we get it in our nose and throat, that we won't pass it on to the next person in the bus or tube or whatever. And the answer is we're not sure about that at all yet. Those studies are, again, underway. I think we all think that if you don't get a symptomatic infection, i.e. you're not coughing or sneezing, you've not got a fever, you almost certainly are less likely to transmit it, but we don't know exactly how the vaccine is going to affect that. So again, one to watch and see.
Thank you. There have been a few questions, various questions about pregnancy and vaccines. Would any of you like to just kind of give a general response to those?
Yes, so I can start off. So what the current advice that we've certainly been given is that the pregnant women were not included in some of the initial trials, and so we don't really know how they may react to the vaccine, etc. But it is a question. If you are pregnant and you may think you're at significant risk, it's something that you may wish to discuss with your GP or your obstetrician. Because you may have other underlying conditions that puts you at very severe risk of severe disease or severe reaction to the COVID infection. So, but at this stage, we're not vaccinating pregnant women unless they have severe underlying health conditions, and even then, it's really on a individual basis and after a discussion of the risks and benefits of the vaccine.
Tom, did you want to add something?
Yeah, no, absolutely. And it's always a tricky one, this, because most trials of any drug, not just vaccines, usually excludes women who are pregnant. And that means we don't have the information. And that makes it quite difficult for healthcare professionals to make a really good choice. I think there are certainly risks if you're pregnant and get COVID. If you get a fever, you're perhaps more likely to go into labour. And if the baby's not well developed, that's obviously a risk to the developing baby. And I think, as Kashif says, I think the key thing here is to look at these on an individual basis and to decide, is this something that would be sensible given that we know the risks if you get COVID when you're pregnant, as against we're not quite sure what the vaccine does. So I think it's something that hopefully we'll get more data on. As more and more pregnant women do receive the vaccine, because we're monitoring this all the time. We will obviously keep that data, we'll know what the outcomes are, and it's a really important issue.
Thank you. The current plan is to give the vaccine spaced out over 12 weeks. We are told that in bacterial infections, to complete the course of antibiotics to prevent antibiotic resistance from developing. What is the risk of viral mutation from suboptimal dosing of the vaccine?
Yeah, I think this is always a concern. If you think of flu, every year, the flu virus, the bug that causes flu, changes just very slightly. And we always have to sort of play catch up. And there's a new vaccine produced, which is rolled out every year, which is quite an effort. And that's how we try and keep pace with the change in the virus. Now, this virus, the one that causes COVID-19, also shows those changes. And there's been some concern that some of them may mean the vaccine doesn't work quite as well. And we know from some of the sort of science studies that at least for some of them, and the one actually that's in the UK at the moment, that's really taken over, probably is effective, is probably quite well controlled by the vaccine, but ones that have been detected in South America and South Africa may not be, but we don't know for sure. There's a difference between what you do in the lab and what actually happens when you immunise real people. So I think this will be a concern looking forward, and it will constantly be monitored. We'll be checking whether these new variants are coming and whether the vaccine is likely to work against them. I can envisage that it may well be a bit like flu in the future, and that we will be receiving perhaps boosters every year for 2 years, I don't know, and that we may have to just tinker slightly with the component of the vaccine to ensure that we're covering these new variants. So I think it's yet to be known, but it's certainly not something that we can take for granted that the virus isn't going to change. It certainly can change, and it may well become more of a problem as more and more people are vaccinated. But I think, look at what we've done so far. It's amazing. In a year, we've achieved so much with this vaccine. And I think for both the sort of technology that is used in both vaccines, it can very easily just be tinkered with to make it work against these new variants.
Thank you. We've still got loads of questions coming in, and I'm quite aware of our time. A very specific question here: should venisections be rescheduled around vaccination?
So I think that I'm not sure if that is a question about whether they're going to have blood tests or they're going to have blood removed for certain health conditions. As we said earlier, that during the vaccination process, we're trying to get through as many patients as possible, and it's very difficult to do any other normal healthcare procedures or acts at the same time as your vaccination. So I would always suggest speaking to your healthcare provider at the time, and you may need to arrange another time. But there's no reason why you couldn't, but it's really down to the logistics of whether that your healthcare professional has the time to do anything else at the time. Thank you,
Kashif. Can you request getting one vaccine over another?
Currently, no. you know, it's a huge effort to get the vaccine rolled out to the different centres that are offering it, and it would really not be possible to say you can have one or the other.
Yeah.
I mean, there may be medical reasons very rarely for one or the other, but essentially no. And again, both vaccines work.
Thank you. Somebody who didn't have the flu jab this last year, should they get the flu jab before the COVID vaccine?
Yeah, I think both, but as I said, I don't think the order particularly matters. You're more likely to get the flu jab more quickly. And the recommendation is you leave a week between the two different vaccinations.
Thank you. If you've had COVID and in turn end up with diabetes, should you still get the vaccine?
Yes.
Yes, yes.
Thank you. A few questions about the new variants of the strain of COVID, which I think you have addressed previously, so I'll just carry on. Yeah, somebody else asking, can I have the vaccine when trying for a baby, or cannot, or can I not try until 2 months after having the second dose? I have had COVID-19 and recovered, and I'm type 1 diabetic.
Yeah, I mean, without wanting to get too specific, I think certainly I know from having talked to people when we've used vaccinations for quite rare diseases, there is always a concern about, is this going to affect my fertility? Is this going to affect if I become pregnant in the next 2 months? And in general, one can be very reassuring. There's no evidence that this vaccine, much like any others, has that sort of effect. And clearly, on top of that, having all these other conditions as well, that makes it, you know, more challenging. I think my advice would be to discuss with your doctor, and I think for those sort of individual things, that's always the best idea. I think, Kashif, I'm sure you'll agree.
Thank
yes,
you.
absolutely.
Thank you. Another two-part question, and I think we've already dealt with the first part. The second bit is something that I've heard a few people saying. I've read that you shouldn't have alcohol for a couple of weeks after receiving the vaccine to help your immunity. Is this true?
There's really no evidence to suggest that's the case. I mean, it certainly, you know, sort of normal social drinking within the government guidelines, there's really no evidence that that's going to cause you any harm. Clearly, if you have more of a problematic relationship with alcohol, that's a different issue. But that's part and parcel of a whole raft of health problems that if you do have a high alcohol intake. And clearly, there are dangers if you stop alcohol. If you have a very high alcohol intake and stop it suddenly, that can certainly make you have quite adverse reactions. So again, I don't think there's anything specific about the interaction there. But I think it's certainly, if you feel you have a problem with alcohol, it's certainly something that there's a lot of help out there for. And to talk to your GP or other healthcare provider and see if you can get a plan for yourself. Kashif, I don't know if you want to add anything to that.
No, I've got nothing to add. No, that was great. Thank you.
Thank you. We really are, I'm so sorry we've not got around to them all, but hopefully a lot of the questions that are being asked have been addressed either in the presentation or with previous answers. If you're very slim with a low BMI, is it an issue due to needle size?
No, as Tom had said earlier on, it's a very small amount of medicine that actually is injected. In fact, it's 0.5 millimeter with the Oxford vaccination, and it's a very small needle. I was vaccinating people in their 90s yesterday and very, very thin arms. If there's any concern that there's not enough muscle around the arms, then we can give the vaccination in the side of the legs or the thighs. So it's not a reason not to have it.
Thank you. A couple of questions about travel. When will it be safe to travel abroad? We had some specific questions about different countries, but I think if we can just do a general question.
Yes, I mean, we all we all want to see the sun. Certainly, if you live in Glasgow, you'd like to see the sun. Yeah, I think the answer is this is a global problem. And I think we have to be realistic about that. And as we've seen, the virus can accelerate and become going from, you know, being quite relatively rare in the community to being really quite common again very quickly. And, you know, governments are always trying to play catch up with that. Oh, it's safe to go. Oh, 2 weeks later, it's not safe to go. So I think it's very difficult. And I think it would be rash to try and predict how that will go. I mean, clearly, we all hope that once larger numbers of people are vaccinated across the world, that travel will increasingly become more and more safe. And I'm an optimist. I do think that will happen. I think it'll be slow. And I think it's going to be difficult to know ahead of time exactly how it's going to play out. I mean, I hope that travel companies honour insurance arrangements and so forth, because the last thing you want to do is book a holiday and then have to cancel the last minute and not get your money back. But in general, that seems to be working out a bit better now that travel companies are recognising that. And obviously, if you have an underlying health condition like diabetes, things like health insurance is important. Again, with us having left the European community, it's very important that you realise that you need perhaps slightly more extensive healthcare cover than you might have done if you were going to France or Spain or Italy previously. So there's a lot to think about there. And I think the future is uncertain. And I think we just have to accept it's going to be a bumpy ride.
Thank you. We've got a specific question here. Does COVID toe pose an increased risk for diabetics?
By COVID toe, I think this is referring to some people get a sort of a bluish discoloration over their toes as being reported. I don't think there's anything particular about that. I've not seen any reports of, for example, skin ulceration occurring after that, which is obviously a concern if you're diabetic. So on the whole, I don't think that that's a particular concern, but certainly, particularly if you're a type 1 diabetic, but type 2 as well, you know, looking after your feet is so important. And, you know, making sure that you get the care that you need, that you see a podiatrist if necessary, and that you follow all the advice that you can. So Dan, I don't know if you want to add anything there.
Yeah, thank you. Yeah, likewise, there's nothing really to say about it affecting or starting an ulcer or anything like that, but even more of a reason to shout and say, let's check our feet every single day, which everyone with diabetes should be checking, and then report anything. So even if you notice after the vaccine that there is something in your foot, report it to your diabetes team, your practice nurse or your GP, just to give them the heads up about it, and they might ask to see you. The NHS is open right across the UK, and although it might seem a different place because people are more in masks, in gowns, or you can't sit next to people, it is absolutely open. And so any concerns that people have with any foot problems or just feet concerns, get in touch with your practice nurse, GP or diabetes team, absolutely.
One final question, which is employment related, is for somebody who's an ITU nurse with type 1 diabetes, has been working non-clinical for 4 months, not looking after COVID positive patients. The nurse has now had both vaccines. Is it now safe for the nurse to look after COVID positive patients in ITU?
So we have specifically asked that question, more generally, obviously, to those who are clinically extremely vulnerable, not just with diabetes, but other conditions. It's a really tough one, and many of my colleagues who are haven't been seeing frontline, you know, haven't been working directly with patient contact, are really keen to get back, as I'm sure the person answering this question feels. It's a tough one, but currently we're saying you shouldn't go back. We don't know how effective the vaccine is going to be for you particularly, and it's a tough one. It may well change, that advice, but currently that's thought to be the safest. And I really feel for people in your situation, because I know, as I've said from many colleagues, who so much want to be contributing and getting back to doing what they're trained to do and professionally able to do. And it's a really tough one. But currently, I guess we're taking quite a precautionary approach to that and saying, well, we still think you should be working not in a non-patient facing role, or at least not directly contacting those who might have COVID. So I don't know, Dan and Kashif, obviously that extends into nursing care and into primary care as well, but I think that's currently what we're advising.
Yes, absolutely. That is the current advice, and every place of work may be able to do a risk assessment. So it may be worthwhile speaking to your manager and ask for a further assessment. But I've got nothing else to add. Thanks.
Dan, did you want to add anything? No, right, thank you. Rather sadly, we will have to come to the end of our questions. I know that there were many more, but I've had a quick look through, and I do feel that we've addressed some of them in the responses we've had already. I'm now going to ask Mari to launch our second poll, and would be really grateful if you could answer these. As I said, it really does help us with planning and improving our services to you. Thank you, Mari.
Okay, Alison.
Thank you very much. Thank you. Well, just before we finish this evening, you may be interested in two further events that Diabetes UK are hosting this month. Tomorrow, in fact, we've got Diabetes, the Immune System and the Heart. That's, as I said, tomorrow from 5 till 6 p.m. Then next week, on Thursday the 28th, we have Being a Parent or Carer to a Child with Type 1, and that will be 7 to 8:30 p.m. Further information about how to join these and any future events can be found on our website, and we'll show you details on a slide at the end. We'll also put up some further information about where you can find out more details about the vaccine rollout. We'll leave this slide up on the screen so that you can have a good look at it, or take a screenshot if that would be helpful. And finally, a huge thank you to our panel members, Professor Tom Evans, Dr. Kashif Ali and Dan Howarth. It was a very last minute request from me to put on and join this event, so I'm really, really grateful to you. I'm also want to thank all of the people who have taken the time to join us this evening. Your questions have been fantastic, very challenging and really interesting. And finally, thank you to my colleagues across the UK who have worked together so well to help facilitate this event. So there's nothing left for me to say, but we hope that you found the event useful. Enjoy the rest of the evening, and please wait to see the slides that will be coming up on your screen shortly, giving you more information. So I'm hoping one of my technical colleagues is going to put that slide up. Thank you very much.
Can I just say, Alison, thank you to you and all at Diabetes UK. I would also say that one of the best sources of advice you can get is from the Diabetes UK website, which is excellent and provides extremely good evidence-based advice, obviously relating to COVID is what we're talking about tonight, but obviously across the board in diabetes, and I think is a fantastic resource if you are able to look at it.
Thank you, Tom.
Sorry, Alison, can I just...
Yes, Kashif,
yeah. As Dan had said, the NHS is still open for business, and for those who are living with diabetes, if you've not had any checkup of your diabetes or assessment in the last year, it's very important you speak to your practice or your diabetes acute teams in the hospital. And I know there was a question about where people living with diabetes would be in the pecking order of getting the vaccine. Now, if you live with diabetes and have other health conditions and you've been keeping quite poorly, then you may be able to speak to your GP or your healthcare provider. You may still be recognized as clinically extremely vulnerable. So maybe a discussion you might want to have with your GP or your hospital diabetologist. So you know there are other ways of meeting that criteria. But as Dan said, I don't think there's going to be much of a gap, and it's really important that when you are offered the vaccine, that you please do take it up.
Thank you, Kashif. That was really helpful. So we'll just leave that final slide up for a couple more minutes and then wish you all a very good evening. Thank you.
Thank you very much for having me, Alison.
Thank you, Dan.
The rest
Thank
of the
you.
team.
Thank you very much, Dan.